Hi, I'm Steve Wooding. I'm the project lead on Mental Health Retrosight. So what we did in Mental Health Retrosight is we tried to understand what benefits research can provide to patients. And we did that by both following research forward and looking backwards from developments in care. Let me say a little bit about how we did the research. So we took 18 pieces of research from the past, from 20 years ago, and we followed them through to the present day. We wanted to understand what had happened to the ideas, what had happened to the people, what impact they were having potentially on patients now. We also took 6 developments or breakthroughs in mental health and followed them backwards to understand where they'd come from, to understand what their research antecedents were. The next thing we tried to do was to understand what characteristics or types of research are most likely to have that patient benefit. And we split between basic and clinical research. And looking over a 20-year timescale, which is the timescale of the study, we found that clinical research had generally had a larger impact on health than basic research had. And the exact way we defined clinical and basic research wasn't key. We found a similar finding with slightly different definitions. We also tried to look in a bit more detail at the characteristics of the researcher and the research to understand what types of research and types of researcher are most likely to successfully translate their research. And 2 things came up there. The first of which is that the breadth of the research and the researcher and the research team are really important. The second thing we looked at was their motivations. So does it matter why people are doing the research? And although we're slightly cautious about this, there does appear to be something in there where people and researchers motivated by trying to make a difference to patients are more likely to manage that.